staff, whoever we decide, to ask the health department to give us some specific data regarding the impact here in Escambia County. We have areas of the county that are unfluoridated with people's water. We've got all the statistics at the health department. We should have them back before water was fluoridated, I'm assuming, more than 6 years ago. They kept this kind of information and this kind of data. And that's my intent, is that we get some data related to specifically only the positive benefits, which is exactly what Dr. Mish speaks to. Let's forget all the negative stuff. I really haven't seen anything other than anecdotal evidence that shows me that in Escambia County, we are seeing a significant increase in dental caries in children. Because anecdotal stories from a dentist, well, I've seen a decrease in the number of patients I've seen with, serious dental problems. Well, maybe those children are no longer on insurance plans, and because of a decline in income in the area, they're now qualifying for different services, and they're not coming to the private physicians. Maybe some of these parents with these children are caught in between. They don't have enough money to go to a regular dentist and pay for it themselves because they no longer have benefits through their business, but they don't make a low enough income to qualify for benefits for their children on medical assistance. I mean, you can't just use anecdotal information because there are so many factors to be considered. And that's what my purpose of asking for 6 months was, that we get some statistic data from this county.
I would support you in that regard. The thought crossed my mind, if we were to curtail further injection of this questionable compound in our water, then it would force the issue for those who really want it to show proof that in fact it is good. Well, we also have some time to validate the yes or no situation. It might very well be a catalyst for action. I just didn't want to see us 6 months from now not having made any move forward on the subject. That's all.
10 years ago about this question, and we had a difference of opinion then. We have a difference of opinion now. And I understand, and I appreciate and respect Dr. Walker's opinion and Logan. And I know that you people gave this thing due diligence when you decided to go with the referendum of 1999. My contention today is that there has been significant research since that date that does suggest a statistically significant correlation between the chemical we're putting in our water and certain health effects.
Mr. Reynolds, let's stick to the validity, to the motion, whether we should...
I'm getting to it. Therefore, what I'm saying about this motion is that I cannot support a 6-month stoppage of the fluoridating water. What I would support is a committee of professionals to report to this board their opinion on the continued use of this chemical in our water. Granted that there's a lot of people in this community who do not agree with it, an awful lot of people. And I understand that there are a lot of people that do, but I don't see how we're going to get scientific evidence in 6 months. And I don't know what the rational cost of taking it out of the system and putting it back in. I'm sure there's probably a deadline on, just approved $300,000 to buy some more of this stuff a couple of months ago. I hope it didn't come from China, but anyway. That's my.
Pensacola was tested the #1 best drinking water in the country. In '97, we was voted the 5th best drinking water in the country, and then we put this hydrofluorosilic acid into our water, and now we're the worst drinking water in the country. I don't need the environmental working group study to look at your own reports and know that there's 45 unregulated chemicals and 21 chemicals that exceed standards of safety that's in our drinking water. The CDC, the Center for Disease Control, in 2005 said 32% of American children have dental fluorosis. Children are now being overdosed with fluoride, even in non-fluoridated areas, from water, swallowed toothpaste, foods and beverage processed with fluoridated water, and our other sources. Fluoridated water is the easiest source to eliminate. Like I said before, I think it's ridiculous that we have to even deal with this stuff.
And I would just like to remind the board, when we are discussing issues like 6-month suspension or anything like that, when you're talking about scientific standards, just bear in mind that that should apply to everyone who is speaking about it, whether it's a random website or the CDC. Everyone has to follow the same scientific standards. And it's easy to look to titles when you're making up your mind. This person's a dentist, this person's American Medical Association. But each one of us has been given a brain, and we're supposed to use it for ourselves and to make up our own mind based on opinion and evidence. Everyone should be able to do that. I respect board members who have taken the time to look at the issue on their own.
Professional evidence on the thing. I just sat through about an hour and a half of some pretty terse discussion. It kind of bit my tongue. The board decided a meeting or two ago that we were going to take this up in 2011. And because of the politically charged environment, it's getting into a situation like Mr. Reynolds says, where it's an emotional issue and a political issue.